If you are experiencing neck or back pain, or for that matter, almost anything that's causing you discomfort anywhere in your body, chances are very, very good that we can help you here within just the next couple of minutes. Dr. Jamie Kaiser is here from Back Into Balance today, talking about NUCA, and we'll explain exactly what that is. But he also brought Don Anthony here, who's we're quickly discovering mutual friends and so forth out in the East County. We'll talk about how NUCA has helped you. But first off, let's just tell people what it is and kind of set it up for them again.
Make it real simple. Okay. You live your life through your nervous system. If you're sitting at home right now, you're seeing me talk, you're hearing things, you're sitting on the couch, you're feeling the seat underneath you, your body, your nervous system is letting you know how you relate to your life. Okay. And every nerve in your body starts in your brain, comes down through this point, and out. And so by default, if we have a structural problem up at the very, very top, it can manifest itself anywhere in the body.
So you basically do a very simple, gentle, and when I say simple, there's tremendous amount of calculations, measurements, and examination that goes in before this adjustment is done.
Right.
But the adjustment itself is pretty simple.
Very,
you
very
want
gentle.
to get people back into alignment, proper alignment.
Create proper structural alignment up at the very, very top so the body can work correctly. And when the body is able to work like it was intended to work, then you notice people who have problems with their neck, problems with their back, problems with their asthma, their sleep. The body works like it's supposed to.
So it's such a wide variety of things that it helps. Okay, let me talk to Don here for a second then and just talk about Don's individual case here. You're in construction?
Correct.
So you do a lot of hard physical work.
Yes, sir.
Have you, over the years, has that been hard on your body?
Very much so. I'm a 5'9" person that in my mind I was 6'5".
Okay,
And,
we all know those guys.
I was heavily involved in athletics in my youth, plus being in construction. In both my athletic endeavors and also in construction, I always tried to do more than my body was capable of doing. And earlier in my life, my body healed rapidly, so I never really paid attention to the damage I was doing to my body.
And doctor, is there cumulative damage over time, even though you think you've healed, for example,
Absolutely.
from a back injury, knee injury, that type of thing?
From a structural standpoint, you give me 107-year-olds. We run some measurements, and the parents can stand directly over my shoulder looking down. Half those kids are going to be out of alignment based on how we define it. Now, are they all going to grow up to get neck pain and back pain? Who knows? But by the age of 15, I've been doing this work for 6 years, seen over 3,500 people. I have never once examined a patient and said, wow, everything's actually just perfect. We've done damage by 15. We're all off. Our body just does a really good job of hiding it, and some people's bodies break down at age 50. Some people's bodies break down at age 14, and I end up having migraine headaches as a kid.
So a lot of these workouts that we do and strengthening things, they're great. They're good
great
for the body, but they are maybe masking a problem underneath by building up certain muscles and compensating.
Yeah, it's making your body stronger, but if you still have a broken system, the broken system is stronger.
So don't stop working out is the bottom line, folks. Okay, so this is NUCA. This is an adjustment right here. And again, I saw you take some measurements there, but a lot went into what you determined about this individual prior to making this adjustment.
Right. The most amount of force that you feel during an actual NUCA correction, again, it's a unique form of chiropractic, but the adjustment itself is actually delivered to that upper head and neck area. And most force you feel, if you've ever had your pulse taken, we're talking about slightly more pressure than that.
So it's very gentle. So now let me again talk to Don. How did you end up at Dr. Kaiser's office?
Very interesting. I have several friends that are chiropractors and had been going to chiropractic and really not getting the relief that I had hoped for. And my wife actually saw this program, and I guess that day there was an 80-year-old man on, and he went into how his life had been severely affected from all his damage, and that he was now walking upright and straight and relatively pain-free. So she sent me to see the doctor. I had absolutely no idea what I was going for.
You didn't know what Dr. Kaiser did, really?
No. I was going to a chiropractor. I didn't understand the difference between NUCA and standard chiropractic.
Okay, and your problems started, what, with a numbness in the neck, and then, boy, from basically from head to toe, you were a mess, it sounds like.
Yes.
What other problems? Back pain?
Posturally.
Yeah. When I walked in to see the doctor, my head was off like this, and I was hunched over like about a 70-year-old man. And in construction, I do a lot of management, and I sit on hard surfaces sometimes, and when I do that, my left arm would go numb. And having a family history of heart disease, I thought, oh my God, even at my tender young age, I'm having a heart attack. Well, I came to find out that I had a degenerative disc in my neck, and that it was compressing and compressing on the nerve, and that was what was causing the left arm to go numb.
So the doctor does his examination, does extensive measurements and so forth, and diagnoses your pain.
Second visit, we get you adjusted.
Correct.
And what did you think as we're doing this?
It was nothing like I expected. As I stated, I've done other chiropractic, and as the doctor just stated, he's doing this little pressure right in this general area here, and I'm thinking, what good's this going to do?
Right.
Well, let me tell you, I walked out that day for the first time in a long time with my shoulders back, my head up straight. I felt like a different person.
I've heard this story, doctor, over and over again from your patients. They didn't even feel that the adjustment was going to do anything, and then they stand up, and immediately they start feeling the results of this. And the interesting thing about this, too, is that with some types of treatment, I mean, you're pretty much told you're going to be back in the office 3 days a week for the next year to 2 years for an extended period of time. And NUCCA works almost the opposite of that.
Yeah. Simple statement, more adjustments don't make you more better. Okay?
Okay.
It's when your body's holding the alignment, that's what allows things to heal. So last time I checked Don, probably maybe like a month ago or so, and his body actually is holding. So you come in, get checked. If everything's great, good. I don't need to do anything. Let's push it out to 6 weeks. I mean, the goal with NUCCA is to get your body to the point where you're strong, you're stable, things are working right, and I say come back in 3 months for a checkup.
So now, how are you doing long term here, Don?
I'm doing real well. Because I'm in construction and the hard work that I do, I still develop lower back pain from once again doing stuff that a 20-year-old does real well, but a person 55 shouldn't be doing. I'm all the time have my shoulders back and my head up.
And I see you riding here too.
Yes. Horses are a passion.
Okay, well, and again, that's what it's all about, folks. We want you to be able to enjoy your passion, whatever it is, enjoy your life, enjoy your work, and do it pain-free. Now, you make this special offer only for San Diego Living viewers, and I want to make it very clear, folks. If you are willing to commit to come in and see Dr. Kaeser, he's willing to see you at a great price and a great deal here, but you have to be committed. The only thing we ask here is that you keep the appointment. If you're one of these first 12 callers that makes this appointment and gets this special offer, you need to keep the appointment. So what are you doing to kind of make sure that happens?
Yeah, as soon as you call the office right now for the first 12 callers, you're going to get our call center. Okay, we're going to get a lot of phone calls. The call center is going to schedule the appointment for you. They are going to ask for a credit card number to reserve that appointment time. Now, we make this whole process very transparent. You show up to the office, we are going to answer every single question you have. As far as how long till I feel better, what do future visits cost, my insurance, I mean, everything gets answered up front before you spend a dime.
Okay, so you're spending no money here. The reason for the credit card, though, is if you don't show up, you have taken a spot away from somebody, from people like Don, that are getting great treatment and great help here, and that's just not fair. And so then your credit card would be charged if you
There's
didn't
a
show up.
cancellation fee.
But a small cancellation fee.
But the main purpose is if you decide that you want to move forward, so we can take the x-rays to figure out how to help you, then it's just $49 for the first visit. That's all. But there is no obligation. You just need to show up for the appointment so we can explain and show what we do and how you can benefit.
And then if you decide to go forward, that small charge there, $49, that new patient special.
Get you started.
Very good. And you offering a great deal on the x-rays?
It's, just $49 total, but you have to make the phone call today.
Okay. Fantastic. Folks, Don, continued good health. I'll see you out there in El Cajon. Kiwanis Club member?
No, Lions Club.
Lions Club member. Oh,
Yes.
I'm sorry. I forgot the organization. Oh, is there a big rivalry between the two?
Absolutely.
Okay. Okay. Lions. There's your representative right here in Don. It's good to see you.
Thank you.
As always. Stay healthy, my friend.
Appreciate
All
it
right.
so much,
Mark. Appreciate
Thanks
it.
so much, Dr. Kaeser. For more information, you go to san-diego6.com and you click on San Diego Living Kiwanis Club. Them's fighting words. I never knew those were actually fighting words before. All right, San Diego Living coming right back.